Hi everyone. Welcome back to English Fab, where learning English is practical, useful, and fab. Today, we're going to explore an important topic, disease, that comes up in daily conversations. Many learners find it challenging to remember specific words and use them naturally, especially when discussing this topic in real-life situations. That's why in this lesson, we'll go over essential vocabulary related to this topic, helping you expand your English skills. These words and phrases follow our English Fab website, making it even easier for you to practice. If you find English difficult, don't worry. You can translate the subtitles into English and your own language like this. Check the description below for extra details. Now, let's get started. Let's go over some essential vocabulary. 1. Types of diseases. Cold, a common viral infection that affects the nose and throat. Flu, a more serious viral infection with fever, chills, and body aches. Pneumonia, a lung infection that causes difficulty breathing. Diabetes, a condition where the body has trouble managing blood sugar levels. Cancer, a disease where abnormal cells grow uncontrollably. Hypertension, high blood pressure, which can lead to heart disease. Asthma, a condition that makes breathing difficult due to narrowed airways. Arthritis, a disease that causes joint pain and stiffness. Migraine, a severe headache often accompanied by nausea and sensitivity to light. Stroke, a medical emergency caused by a lack of blood flow to the brain. Tuberculosis, a bacterial infection that affects the lungs. COVID-19, a viral disease that affects the respiratory system. Food poisoning, a sickness caused by eating contaminated food. Allergies, a reaction to substances like pollen, dust, or certain foods. Dementia, a disease that affects memory and thinking, often seen in older adults. 2. Medical symptoms. Fever, a high body temperature due to illness. Cough, a reflex to clear the throat or lungs. Sore throat, pain or irritation in the throat. Runny nose, when liquid comes out of the nose due to a cold or allergies. Headache, pain in the head or forehead area. Fatigue, feeling extremely tired and lacking energy. Shortness of breath, difficulty breathing, common with asthma or lung diseases. Dizziness, a feeling of lightheadedness or losing balance. Nausea, the feeling of needing to vomit. Rash, red, itchy, or irritated skin. Chills, shivering or feeling cold due to fever. Inflammation, swelling, redness, or pain in the body. Weakness, lack of physical strength. Sweating, excessive perspiration, often due to fever. Vomiting, forcibly expelling stomach contents through the mouth. 3. Treatments and medications. Painkiller, medicine that reduces pain, such as ibuprofen or paracetamol. Antibiotics, drugs that treat bacterial infections. Vaccine, a shot that helps protect against diseases. Syrup, a liquid medicine, often used for coughs. Inhaler, a device used by asthma patients to help them breathe. Injection, medicine given through a needle. Bandage, a strip of fabric used to cover a wound. Surgery, a medical procedure where a doctor operates on the body. Chemotherapy, a treatment for cancer using strong medication. Therapy, treatment for physical or mental health conditions. First aid, basic emergency medical care before professional help arrives. Prescription, a doctor's written order for medicine. Herbal remedy, natural medicine made from plants. Physiotherapy, exercises and treatments to recover from injuries. 4. Healthcare and professionals. Doctor, a medical professional who diagnoses and treats illnesses. Nurse, a healthcare worker who assists doctors and takes care of patients. Surgeon, a doctor who performs operations. Pharmacist, a specialist who prepares and gives out medicine. Patient, a person receiving medical care. Emergency, a serious or life-threatening medical situation. Hospital, a place where sick people receive medical treatment. Clinic, a small medical facility for checkups and minor treatments. Ambulance, a vehicle that transports sick or injured people to the hospital. Checkup, a routine medical examination. X-ray, A scan that looks inside the body to check for injuries or illness. Diagnosis, a doctor's decision about what illness a patient has. Treatment, the process of curing an illness. Medical insurance, a plan that helps cover the cost of healthcare. Recovery, the process of getting better after being sick. 5. Prevention and hygiene. Hand washing, cleaning hands to remove germs and prevent sickness. Mask, a face covering that helps prevent the spread of germs. Sanitizer, a liquid that kills bacteria and viruses on hands. Social distancing, keeping space between people to prevent disease spread. Healthy diet, eating nutritious food to maintain good health. Exercise, physical activity that keeps the body strong. Sleep, resting to allow the body to heal and recover. Vaccination, getting a shot to protect against diseases. Avoid junk food, limiting unhealthy foods to prevent weight gain and illness. Wear gloves, covering hands to prevent contact with harmful substances. Stay hydrated, drinking enough water to keep the body healthy. Personal hygiene, maintaining cleanliness to prevent disease. Boost immunity, strengthening the body's defense against illnesses. Sun protection, using sunscreen or covering skin to prevent sun damage. Quit smoking, stopping tobacco use to improve health. Now that we've covered essential vocabulary, let's see how these words are used in real-life sentences. I'll also share useful tips so you can use them naturally when describing food in English. 1. Types of diseases. My grandfather has diabetes and needs to check his blood sugar regularly. Diabetes requires daily monitoring and proper diet management to maintain healthy blood sugar levels. The flu spreads quickly in winter, so I always get a flu shot. Flu vaccines reduce the risk of severe illness, especially during colder months when people spend more time indoors. 2. Medical symptoms. She has a high fever, so she stayed in bed all day. Rest is important when you have a fever because it helps the body fight infections faster. I felt dizzy after skipping breakfast this morning. Skipping meals can lower blood sugar, leading to dizziness and fatigue. Eating small, regular meals can help prevent this. 3. Treatments and medications. The doctor prescribed antibiotics to help fight the infection. Antibiotics only work for bacterial infections, not viruses like the flu or common cold. After the surgery, he needed physiotherapy to walk again. Physiotherapy helps patients recover strength and movement after surgery or injury. 4. Healthcare and professionals. The nurse checked my temperature and blood pressure. Nurses play a key role in patient care by monitoring vital signs and assisting doctors. I went to the clinic for a routine checkup last week. Regular checkups help detect health issues early, preventing serious problems later. 5. Prevention and hygiene. Washing your hands regularly helps prevent infection. Hand washing removes bacteria and viruses, reducing the risk of getting sick. A balanced diet and exercise help boost immunity. Eating nutritious foods and staying active strengthen your immune system, helping your body fight off illnesses. Great job today! You've learned some important vocabulary that will help you feel more confident when talking about this topic. Now, try using these words in your daily conversations or writing. The more you practice, the more natural they will become. And remember, don't be afraid to make mistakes, that's how we learn. If you ever need a refresher, you can always check out this video again or visit English Fab's website for more learning resources. Okay. Thanks for watching today's lesson on English Fab. I hope you found these English tips useful and feel more confident. Remember, practice makes perfect, so try using these phrases in your daily conversations. If you enjoyed this video, don't forget to give it a thumbs up, share it with your friends, and subscribe for more Fab English lessons. Until next time, keep practicing and stay Fab.